Thyroid basically, as the name suggests, thyros. Thyros is basically an armor, the armor which the knights used to have. So, shield, basically, shield. So, thyroid gland is basically a shield-shaped gland in our neck, just in front of our neck. Any malignancy or cancer occurring in thyroid is thyroid malignancy. What is cancer? Again, any uncontrolled growth. So, how will the patient present? Patient will present with some kind of lump or nodule in the thyroid gland, and usually it is very visible to the naked eye of the person who is sitting in front of the patient that there is some kind of swelling in the anterior part of the neck. So that is how usually patient presents for thyroid malignancy. Thyroid cancer is not very uncommon in Indian scenario as such, uh, but uh, and thyroid cancer is usually more common in females as compared to males. So that is one thing which we have to really look about. There are multiple types of thyroid cancer. The most common is papillary thyroid cancer, followed by follicular thyroid cancer, then medullary thyroid cancer, then there's anaplastic thyroid cancer, there are lymphomas. Apart from that, there can be thyroid malignancy which comes as a metastasis from some other malignancy. Okay, so these are the six common types of thyroid cancer. Thyroid cancer is the most common type. It is usually seen in young females and young males as well. The good part about papillary thyroid cancer prognosis is really very great. So causes of thyroid cancer are basically many times it is genetic. There can be some kind of radiation exposure. There can be some kind of many a times patient, if there is an overexposure or overuse of thyroid gland, which can be seen in cases of iodine deficiency, that can lead to a transformation into malignancy. So these are some of the common key causes. Radiation exposure is a very important cause, and the patients earlier, back in older times, or say 20-25 years back, many a times radiation was given to treat some benign conditions such as the acne or some kind of minor malignancies. So these patients eventually, when they grow up, it was seen that they were having high increased incidence of thyroid malignancy, and most of them had papillary thyroid cancer. So radiation exposure is a very important. So the patient will present with some kind of swelling in the anterior part of the neck, and these are the early symptoms. This swelling will usually move when the patient is swallowing or trying to drink some water or something. So this is the classical presentation of thyroid cancer. Apart from that, if the patient is having some thyroid hormonal abnormalities, then patient can have symptoms related to it. But the classic presentation is a thyroid anterior neck swelling. We use ultrasonography machine to characterize the nodule, see what is the quality of the nodule. So nodules can be of different types. Some nodules can be totally solid, some can be cystic, there can be some liquid component in the nodule. So that basically shows the possibility of it harboring malignancy. So if a nodule is highly suspicious of malignancy based on ultrasonography, then we go ahead with fine needle aspiration cytology. A needle is put in the nodule or that swelling, and fluid is aspirated, and that is analyzed under microscope, wherein we give a basic architectural pattern or of the cells, that how they are, and based on that we reach to a possibility of malignancy. So this is called as Bethesda system of staging, when we get a staging from 1 to 6, 6 being 100%, almost 99% malignancy, and 1 being non-diagnostic, and 2 being benign. This is the classic investigation which is done. Apart from ultrasonography, the disease is kind of an advanced stage, or maybe the swelling is larger in size, and many people, they choose or opt to go for some cross-sectional imaging kind of thing, wherein we use either CT scan or MRI, depending upon the possible organs involved, to see the extent of the disease. Depending upon the type of thyroid cancer, if it is papillary thyroid cancer, it is curable. The prognosis is really very great, up to upwards of 95-97% patients survive for life There's no decrease in their longevity in life. If it is anaplastic cancer, it is considered an incurable disease. Follicular and this medullary cancer, they also have good prognosis depending upon the stage of the disease. But usually thyroid cancers are curable. Surgery is the mainstay of treatment. We have to remove the disease, and post disease removal, many a times we need to take help of some kind of radioactive iodine treatment. This is basically iodine in a radioactive form is given per orally, most commonly either in capsule form or liquid form. And this medication, when taken in the body after the surgery is done, this medication when taken in body, it eliminates the possibility of thyroid cells present even in these microscopic form anywhere in the body. So that is, but again, depending upon the stage, and very small T1 early stage well circumscribed lesion, usually we do not give radioactive iodine therapy. In diseases more than that, iodine in some form, radioactive iodine is required. Recurrent laryngeal nerve are the nerves which supply our vocal cord, this voicing cords. So, if the surgery, if the disease is advanced and it is involving the nerve, in that scenario, we might have to sacrifice the nerve, and the patient can end up having some kind of changes in voice. First thing. Second thing is that thyroid gland per se, if we are removing thyroid gland, the functioning of thyroid gland is lost. So patient will need to be dependent on thyroxine supplementation and will need to take thyroid tablets lifelong. Many a times, these parathyroid glands are in close proximity to the thyroid gland, and if many a times we need to remove parathyroid glands as well. So these patients might need to take help of supplemental calcium as well. Thyroid is an organ in the body, in neck, and blood comes to thyroid gland, and then blood goes out of thyroid gland. Similarly, lymph comes to thyroid gland, and lymph goes out of thyroid gland. So, if that lymph which is coming and going, or blood which is coming or going, is going through that part of where the malignancy is present, and suppose some cell breaks from that nodule and goes into the bloodstream, then it will definitely lead to spread of the malignancy. And thyroid malignancy spreading to lymph nodes is not very uncommon. Many patients present to us with disease in their lymph nodes as well. Actually, many patients present with a presenting complaint with a neck in the lateral part of the neck, with a swelling in the lateral part of the neck, which on diagnosis or investigation comes out to be a thyroid malignancy, and hence we reach to a conclusion that okay, this patient is having thyroid malignancy. So thyroid gland disease spreading to lymph node is not really uncommon. And in these cases, they can be easily tackled with total thyroidectomy with lymph nodal dissection on the ipsilateral site with some kind of central compartment dissection. And if need be, then contralateral nodal dissection as well. Diet is something which we should take care of. Iodine supplementation in our diet should be adequate. Usually nowadays, thyroid malignancy because of iodine depletion is really rare, because all our salts are fortified with iodine. Apart from that, we should be really careful about any family history of thyroid malignancy. If someone in the family is having thyroid malignancy, they should definitely go and meet some genetic counselor and their oncosurgeon to get a guide on it. Apart from that, nothing specific. And this radiation exposure is something which many professionals should be cautious about.